Welcome, everybody. Happy Wednesday. Welcome to another episode of Wellness Wednesday Inspiration. My name is Fernanda, and I'm here with Dr. Linda Marquez. We have an amazing guest today, Dr. Alka Patel, and we're going to be talking about a topic that basically impacts all of us. And I think at some point or another, we all have experienced burnout from having to deal with work and home and so many different responsibilities that we all have in our lives. We've never really talked about this topic before. I'm excited to bring a guest that we can get the most insight about this topic. Once again, it's very important because I think most people have experienced it, but it's not a topic that is commonly talked about or even acknowledged. So very excited about today. Dr. Linda, how are you?
I'm great. Happy Wednesday, my favorite day of the week, Wellness Wednesday Inspirations, of course, and always good to see you and connect with just some amazing people. And yes, like you were mentioning, this is such a relevant topic and people are afraid to talk about it at times. So I'm excited about having Dr. Patel here with us. So yeah, everything's going great. I'm getting ready for my retreat, leaving this weekend. And you were out of the country and just got back, but you had also gone to Dr. Joe's retreat. So it's going to be fun connecting afterwards, see where we are. I'm sure our alignment's going to be, I think, enhanced as a result of being there, because when you go to places like that, a retreat, when you go to a seminar to improve you as an individual, you cannot help but walk away more empowered, excited about life, passionate about life. But the most thing that I love that I've kind of missed during COVID is really getting together with other people, because the energy in the room, the excitement, the passion, the business deals, the ideas that just flow through there are amazing. So I'm super excited.
I'm super excited for you. Yes, I cannot wait for you to have such a wonderful experience next weekend. And we need to connect before you go. I do have some news to share with you. But yes, I'm super excited. It's life-changing. And every time you invest in yourself, no matter in what way, whether it's taking time for yourself, whether it's reading a book, whether it's going for a massage, whether it's going to a seminar, whether it's meditating, whether it's literally just pampering yourself with your favorite meal, whatever it is, it always pays off, because you are the most important person alive today. And if you're good, you can make everything around you better. So
absolutely, 100%. And we have the perfect guest to share strategies and her story. So we'll get on with Dr. Alka Patel. She's a doctor. She's also a coach and a speaker and author, and also has a podcast. So this podcast is designed to inspire people and really to take them to create balance in their lives, because burnout is something that most people don't talk about. And she's going to share her story, because I think we all can learn more from stories and going through a situation, instead of just telling someone, oh, do this, do that. But I think when you go through it, it really changes things in your life, but the way you talk to other people, and especially because we are in the health field with patients that they can really understand. And I think those are the patients that we tend to attract to our office, or clients that we work with on personal growth, are the ones that we were before we were where we are now. So it's our old version, and we tend to attract those. But she's going to share her story about that, because she's been in practice for many years, and like a lot of us, we overwork, we overcommit, and it does lead to burnout. And I can totally relate, because I was there at one point too. And I think you were too, right, Fernanda? I mean, and at a young age. So it can happen at any age. It doesn't matter if you're in your 40s, 50s, you can just be starting your career in your 20s and still experience it within a couple of years. So it's really an important topic that we're going to share today. So let's bring on the doc onto the show.
Let's do it. Dr. Patel, how are you doing today?
Hello, really happy. I'm delighted to be here. I'm great. Thank you for asking.
Thank you so much for being here with us today. We are super excited to bring this important topic. on the podcast today, just talk about and give light to an actual real topic that not a lot of people understand and identify with, but they may be experiencing it, which is burnout. So thank you so much for coming in today. Can you tell the audience a little bit about you, please?
Wow, I think you've already given me a great introduction with all those titles that we have. And we often introduce ourselves by our titles, don't we? So, yes, I'm a GP. I'm in London, in the UK, and I'm a lifestyle medicine doctor, coach, podcaster, speaker, author. These are all titles, but, who's that essence, I guess? What is it that kind of fires me up? And at the moment, it's absolutely talking about lifestyle and lifestyle medicine and self-care and wellness and all the things that you two are so passionate about as well. And that is what gives me my heartbeat every day, for sure.
That's wonderful.
It's such an exciting, such an exciting field. Right now, as you say, like functional medicine, lifestyle medicine, and it really all goes back to the root cause.
Yeah.
Which we tend to ignore, and sometimes we don't want to address it because it's painful, and it's always more painful. Or what's the saying, that would you rather make change in pain and suffering or enjoy in happiness? And we're going to be driven. Most of us are driven to make change until something happens to us. But it's much better if we do it when things are actually going great. But that's not what often we see. And, in our lives, and it just doesn't apply to working women and men, but everyone in life.
It's so true. I think we're driven by needing those sort of instant rewards in our life. And when something is instantaneous, we don't want that. We want the quick fix. But actually, the stuff that gives you that fulfillment and that contentment, it's in the distance. And we also have to work for what's ahead of us as well as what's right in front of us right now. And, you mentioned pain and suffering and happiness and joy. We've got to be able to allow space for all of that in our lives, haven't we?
Yeah,
absolutely. Very true. Very true. So, Dr. Alka, can you talk to us about what is burnout? Let's get to the bottom of it. What is it?
What is burnout? It's a word that we're hearing increasingly about, aren't we? And we do need to give it a definition so that actually we feel able to talk about it a lot more. And actually in the medical field, it now has been given a definition. So I would love to share that with the listeners, because I think that's important, because we often confuse burnout with so many other things as well. So I'm going to give you a definition, but I wanted from that just for you to remember 5 really key words. Sorry, you'll hear my dogs in the background barking, happy puppies barking away. So the definition of burnout that I use is that it's a constellation of detrimental, psychological, and physiological effects that are caused by your work and your relationship to your work. So I just want to zone in on those 5 words that are really important to remember, I think, here. So the first word is detrimental. Burnout is not helpful to us at all. And the second word is psychological, because burnout affects our emotional well-being. It shifts our mindset. Third word, physiological, because there's hormones involved. There's chemical mediators, there's neurotransmitters that we release that change in burnout, and they then affect not just the emotional side, but also give us our physical symptoms. Fourth word is work, and this is really important because burnout is a work-related phenomenon. You can't be burnt out by everything going on in life. It's very, very work-specific. And the final word in that definition is relationship. It's about the connection that you have with your work. So I think it's just really important to just think about those important keywords when we talk about burnout.
Wow. I don't think I've ever heard such an amazing definition of burnout before. And it is so true. It is all about it can be healthy no matter what, right? It can never be healthy. Yeah. And it can never bring balance if you are having burnout from your work. I mean, how I believe, and I truly believe actually, that life is all about balance. Finding balance at work, finding balance in your relationships, finding balance in your me time, finding balance in every area of your life. And if the scale is kind of tipping over in one place, that's not causing any type of balance, and it creates even more unbalance in different areas of your life. So very important. Thank you for that.
Yeah.
Now, Are you also familiar with, and I know we hear this more, and it just depends on who you talk to in the functional medicine world, and sometimes medical doctors will say adrenal fatigue, or people will just start using the word, the term adrenal fatigue, where it really isn't adrenal fatigue, and sometimes people say, well, I have adrenal burnout, but it's more the hypothalamus pituitary adrenal dysfunction. HPA dysfunction is more like how we define that. So would you say that that's more like the medical term, or we're looking at it from the physiological, whereas what you just described is more people can get it? It's like a practical view of what it really looks like.
Well, I think there's a really important distinction to be made here, because one of the common questions I get asked is, what's the difference between burnout and stress? And when we talk about cortisol, when we talk about the hypothalamus, the pituitary, the adrenal gland, actually, we're talking about stress, and burnout isn't the same as stress, even though we often talk about them in the same breath. I'm burnt out, I'm stressed. So again, let me just give a distinction here, because if you think about when you're stressed, it involves too much, too many pressures, too many demands on you physically, mentally. It's about over-engagement. Whereas burnout is actually the opposite. It's not enough. It's feeling empty, feeling mentally exhausted, feeling drained, devoid of motivation. It's disengagement. So I think those two distinctions, again, are really important, so that we understand what's going on physiologically as well. Because yes, stress can tip you into burnout, but then what happens afterwards, the cascade, is very different, and the actual feeling you get is very different from being on edge to being devoid of energy. Two different things.
So it's like long-term stress can lead to burnout.
Yeah. I don't know if you've seen that Yerkes-Dodson curve, where we all need that stress hormone. We've got to love stress. Stress is not the enemy. Stress activates us, it's going. But when it's long term, when it's uncontrollable, when those triggers are constant, then we're going to tip, and it's a very, very fine point, isn't it, between tipping from kind of being activated by our stress hormones in a positive way to actually into burnout. I don't know if you found this in your own kind of business school, but often it's the passion that we have for our own business that fires us up, and then in the same way it burns us out as well.
Wow.
So, Dr. Patel, thinking about that, who is at risk for burnout? Anybody that overworks, basically, or who is more at risk of suffering from burnout? At what point do you see people that are getting or experiencing burnout more than others? What are the common characteristics, would you say, about burnout?
So I think, actually, I don't say this flippantly, but I think everyone is at risk of burnout. So if you're feeling stressed, then that's that precursor of burnout. So you're at risk of burnout if you're experiencing stress. You know what? If you're also living life passionately and loving what you're doing, and you're on that go, 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 as I said, that passion becomes a thing that then actually burns you. So none of us are actually immune from burnout. There isn't this burnout vaccine that's on its way to us at all. We can all be burnt by burnout itself. So we've got to be able to knock that fire out of it. Because actually, without a flame, there is no fire. And so we have to tune in to those very, very early signs that, we tend to ignore. The telltale signs are there. There's no diagnosis, as doctors, we're not going to say, here's the test for burnout and this is your diagnosis, because actually the challenge for all of us and, for the audience listening is most of us already know if we're in the burnout zone, test or no test, because we need to pause and just see it. So if you've got that, imagine, that precision timetable of your day that you're doing, so you can squeeze everything into it. You're that constant clock watching, so you can get that next thing done, that sacrifice of sleep so you can be awake more, the sort of independence that we feel that we've got to do it all. We skip meals, we don't ask for help, we eat with sort of compensation, we drive when we're feeling drowsy. These are all those signs, aren't they? And then we feel the drain and the emptiness. And these are all telltale signs. But instead of pausing and tuning in recognizing those signs, we keep going. So I think, the most important thing is just to tune in. Our bodies and minds tell us everything we need to know. We just got to listen and really kind of, pay attention to the signals, I think.
So you're talking about some of the warning signs of, what to look at, because some people will think, well, what's too much for one individual is not a lot for another individual. However, how do you determine with patients or clients that, okay, this is something you should not ignore? Obviously, like elevated blood pressure, is one that, if it's like 200 over 140, which we have seen before, what are some that you have seen that are very common, because you've worked with so many patients that you tell them, what, this is an 811 situation, because we can tell at times by labs, but also when just having a conversation or doing an intake with the patient.
Yeah, no, I think you're absolutely right. I think I often use the 3 R's of burnout. And the first R is recognize, isn't it? And recognition comes from looking at sort of emotion, behavior, and physical signs as well. So, the warning signs that do something now are physically persistent fatigue, recurrent illnesses, recurrent infections, headaches that don't go away, muscle pains, appetite changes, poor sleep. Those are the physical signs that you're getting that says this is time to pay attention. The emotional side, what are those feelings of failure or feeling helpless, detached, losing motivation, a negative outlook, not being satisfied? There again, the emotions and the behaviors. What do? You find yourself withdrawing from your responsibilities, you find yourself isolating from others, procrastinating, not finishing that project, getting that job done, and also, of course, using food, drugs, or alcohol to cope. Those are certain warning signs that we need to sort of really recognize.
Dr. Patel, just really quick, your sound kind of goes in and out, and it was a little bit more noticeable maybe on that last part. Just want to make sure that the audience is able to get everything that you're saying, because it's a little bit difficult to understand at times.
Okay, I'm as close to the mic as I can. I can hear some background noise. I don't feel it's coming from my end, but I might be wrong.
It sounds maybe a little bit better now. Right now, let's continue to go and see. I will let you know if it gets if it's a little bit difficult to understand. Okay.
Can you hear us okay, though? You can hear us okay?
I can, but I feel like I'm getting an echo when you guys are talking to me. So
I think it just might be the highway traffic on the internet. So we'll do our best with all this. So as you were talking about, different signs, what people really shouldn't ignore. When do you know, like, I need to make a change now? Because that happened to you. And I think this is a good tie-in with your story. You ended up in the hospital, right?
Yeah, I did. And that's the late phase, isn't it? That's partly kind of not wanting to look at the telltale signs and know what's going on. But yeah, sadly, I did. I had a fever. I got a physical sign to tell me that something wasn't right. Now, this was a fever well before we started worrying about COVID fevers. It was a simple fever. I should have been able to shake it off. But what I did instead was I went to work because patients needed me. I had prescriptions to sign and things to do. So off I went to work. And actually, 24 hours later, the fever escalated and my body just went into shutdown. My kidneys got distressed. My liver decided it didn't want to work anymore either. And I did end up in hospital. I had surgery, which turned out to be unnecessary, looking for a source of the fever. So I've ended up with a wound, which is a constant reminder, a scar that reminds me of this time. And you know what, when I was going through this, it was actually my birthday. So I woke up on my birthday in hospital with a surgical wound and a tube in my nose, and really ready to give up on life because the energy to live was just too much. And I remember seeing my children. I've got 3 children, and my middle son has the same birthday as me. Um, and it was such a poignant time for me. And I remember my husband just loving them and looking after them. And I just thought, I can leave this world. I can go, because they're happy without me, and I don't have the energy to carry on. But of course I did, and I recovered. I came back. But you know what? At the time, I didn't know what to call it. I just called it failing. I called it being vulnerable. And who wants to talk about that? I didn't want to even talk about what it was. And it took me a while to understand and accept that actually, that curve of doing too much and giving too much and having those higher standards of being the best mother, the best doctor, the best wife, the best daughter. We all want that, don't we? But actually, who got lost in the process was being the best me. And the ripple effect for my family and everyone else around me was huge. And so those are warning signs that had existed for. There were warning signs that were there for a while. I chose to ignore it because I didn't want to be vulnerable. I didn't want to expose that I couldn't do it all, not to that standard. I think that's what we really need to be talking about, is sharing our vulnerability. And I'd say, especially as women, I think we need to create a space where we share how we are feeling, share our vulnerability more. Because I think if we shared our vulnerability, we wouldn't feel so vulnerable. If we didn't feel so vulnerable, we'd feel more courageous. And if we felt more courageous, we would ask for more help. And if we asked for more help, we wouldn't feel so vulnerable. So there's the cycle.
That is very powerful, and I think I personally can relate to that. And I have these. It's a belief, right? One of those paradigms that we all have about, if you ask for help, you are being seen as weak, right? And you gotta be able to do it all, and you gotta be able to manage it, and you gotta be able to put a smile on your face as you're doing it, and basically just keep on doing everything and pile more responsibilities on top of the ones that you already have, because you can handle it. And so I know for a fact that a lot of people feel that way. And they rather stay quiet about it, whether they're feeling that way or not. They rather just not say anything, because saying something, like you were saying before, it's a sign of quote unquote vulnerability, right? You're admitting that you may not be able to handle it at all. And if you ask for help, you may be seen as weak. But in the contrary, when you ask for help and you obtain help, you may be getting that strength back to be able to even do and create even greater things. And it's not about just doing it all yourself, but doing the most important things that you can do, and just being able to delegate, right, the other tasks and the other activities to somebody else, so you can continue to remain strong for the things that you and only you can do best yourself. So go ahead.
What I realized actually is that the act of asking for help is actually an act of giving, because actually people love to help, and letting people help you is giving something to others. And the more I start thinking about asking for help in that way, the more, of course, I want to give you something. I want you to be able to have something. And we all want something bigger than ourselves, don't we? That act of generosity and kindness is so important to all of us. So I've reframed my mindset around asking for help, is that actually I'm giving in the same breath that I'm asking.
That is so powerful.
That is beautiful.
I mean, that just like, wow, that just like poked my heart. Like, that is powerful, because they'll look at someone like you and say, what can I do for her? She's got it all together. And when you actually ask them for something, they're going to be almost like honored, but you're giving them the opportunity, because it's kind of saying, I can't do this by myself. So it almost like puts them at the same level, puts you and the patient at the same level instead of I'm here, you're down here, do as I tell you. But when we're at the level here, it's like we just all want the good for everyone, because when it's always like what the change that we want to see in the world, we have to become that change in essence. So it's beautiful, like just you putting that in, just wow, just like, oh, touched my heart. So thank you for sharing that. That was just really powerful. Because and the thing that you just said, you love your R's, and when you were in the hospital, I thought about it was maybe like a sign of your rebirth and to reset your life, that happened, and how ironic on your birthday it was almost like a time for you to be reborn. So thank you for sharing. I'm sure a lot of people are going to be able to connect with that.
Yeah, no, and thank you for that. Again, I hadn't allowed myself to think of it like that, that sense of rebirth and having another opportunity and a chance. And again, I think that's something I'm going to take away from today for sure. Thank you.
That's beautiful. So, Dr. Patel, when someone is experiencing those signs that you were mentioning, the physical signs, the psychological signs of burnout, and if they choose not to listen to those signs, if they choose not to listen to themselves, to their body, to their mind, and they continue on the journey, they continue to kind of pile on and continue to do all of these things for everybody and refuse perhaps to ask for help, at what point or what happens afterwards? We know your story, so you ended up at the hospital, but is that what happens to most people?
What happens is a ripple effect that then follows, because we don't just affect ourselves by our actions, we affect other people around us, don't we? And that is actually what happens if you don't tune in to what you need. And I think that's really important to bear in mind. And I know we talk about things around burnout, our relationship with work. And Fernanda, you were saying you talk about work-life balance or what. I talk about work-life blend. Life is a blend. We don't just kind of, we'll do more of this or do more of that. We're constantly intertwining. It's work and life blending together. And so therefore, if you allow your work and your relationship with your work to affect you, it's going to affect every other aspect of your life.
So well said. Gosh, it just gave me an aha moment, because it does. Everything you do also impacts your family, your practice, your friendships, everything, even the stranger at the store. Because if you're in a bad mood and you take it out on them, or maybe they're having a bad day, and I always like to try to give someone a compliment when I'm in the store, or the cashier. I'm actually just, how's your day going? If they're saying, oh, not that great, try to just have some conversation and really just connect with them. And it may only be for 30 seconds or a minute, but I think when we don't take care of ourselves, we're being selfish. And so many times people say, well, you're doing all this for you. You're being selfish. You're not tending to your family. And it's like, no, it allows you to be a better version of you when you take care of yourself first. And that's so difficult for women especially women to understand. Why do you think that is? Or, I mean, working with so many women and men too, but I think with women, just because we're high achievers, obviously, the kind of profession we chose to be in. We wanted to make a difference in this world. We wanted to leave our mark to really change the world for the better. So what do you say to women that, if I were to come to you and I'm like, gosh, telling you all my problems, and what would you say to someone like me?
So I think it's really hard because we wear so many hats. And I think the important thing is to really think about your identity amongst all of that, and actually your role, your title. I know I came into this live today and I talked about, those titles, but your label is not the essence of you. And I think we have to be really mindful of that, is that it's our qualities that show up. It's our character that shows up. So what is that you want to show up in the world? I don't want to show up today as as doctor, I want to show up as kind. I want to show up as compassionate. I want to show up as understanding. Yeah, I've got a title, doctor, but actually, what's the person behind that? And I think, again, if we all spend some time take a bit of time for some introspection and started to get curious about ourselves. And you can only get curious about yourself if you allow space to do that. Because otherwise, your to-do list is just going to increase and increase and increase, and you never give yourself that space. But it's fun getting to know you, actually. Have this curiosity about, am I actually funny? Did I just make someone laugh? If those negative thoughts are floating around, that's just occurring in my story, but that doesn't have to be me. So I think it's really important. And I think, as a doctor, one of the things I really realized not that long ago, actually, was that I know a lot about my patients. I know where they're going on holiday. I know where their kids go to school. I know what kind of socks they wear because I examine them on the couch. But what I didn't make an effort to find out for a long time was what matters to them, what's important to you. Because what's important to you becomes your driver in life. It becomes your motivator for everything that you do. So I think purpose and intention is so important for all of us as our compass, as our guide through life. And so taking the time out to discover that about yourself is an incredible thing to do.
That's a lot. I'm here taking notes. That's just so powerful. You just unloaded a lot of gems. I love it.
Wow. I am actually like mind blown right now. And it is so true, Dr. Patel. And perhaps the more titles we have or the more education we have, sometimes we tend to identify ourselves with those titles, like you were saying, right? Well, I have a master's, I have a doctorate, I have this, I'm a lawyer, I'm a doctor, I'm a dentist. But who are you behind those titles? What is your essence? Who is the real you? And what matters to you the most? And what can you do for others behind all of those titles? So it's kind of like literally, in a sense, getting naked and presenting yourself at your core. And that was so beautiful. And that is so important because, in a sense, I feel like we use those titles to hide ourselves, right? Because if we put those titles on, then, okay, I'm the doctor, so I can do this for you. Or I'm a nurse, I can do this for you. But I'm not showing sometimes myself as who I really am, right? I'm showing this persona who has the title, but not that many times is not me. Yeah. Beautiful, beautiful. So Dr. Patel, if someone is experiencing burnout right now, if someone feels that they are experiencing all of the qualities or the characteristics, physical, mental characteristics that you described, what can they do about it? Is it reversible?
Yeah, absolutely. I think once you've recognized it and then you really have to start to think about reversing it and recovering from it, more importantly. So I like to use the analogy of exercise. So, when we stress a muscle, trainers, athletes will tell you that they need recovery time after they're working out and training, because actually they increase the capacity of the muscle function as a result of rest and recovery. And that's what we all need to do. So we've got these busy lives where we're, stressed and busy working out and completing our to-do list. But within that, we also need to oscillate into space for recovery. And that's the most important thing, is to oscillate between increased stress or activation and then absolutely active recovery. So I'm not talking about, sitting in front of Netflix mindlessly or scrolling on your phone mindlessly. I'm talking about active recovery, where you're taking positive steps to do the things that make you feel good, that are changing all those, neurotransmitters and those pathophysiology of what's going on, reducing inflammation, increasing your dopamine, all those things that really help. I think one thing that we need to focus on doing is also setting ourselves our timeline, which I love talking about. So if we have things to look forward to, it actually lifts us, doesn't it? So making sure that, annually, quarterly, monthly, weekly, daily, hourly, you've got something that you can turn to that is going to give you that lift. even in the moment. And in the moment, what do we all have? We have our breath. It's an incredible recovery tool. We know from the research, don't we, that if you reduce your breath rate down to 6 breaths a minute, you switch off that cortisol, you switch off that stress response, you turn on your relaxation response, and all you have to do is breathe in for 5 and breathe out for 5. In that moment, when you recognize those signs that things are going off, and these tools are in our gift.
I love that. That's awesome. I was writing notes here again. I love how about sometimes we do tend to forget about that. We just continue to go on with life, but really having, like you were saying, like the weekly goals, maybe have a daily goal of, okay, I'm going to take some time to just do some breathing, nostril breathing, or something that you can focus on, or just get out of my chair and go walk around, and then the weekly to the monthly, so that and even just have a goal of at the end of the month, or plan a vacation or an event or something, because you get excited about that. Otherwise, I think that can lead to burnout as well. It's just, you're just going, it's like you're driving, but you have no destination, so to speak.
Yeah, no, absolutely. And I've got a little toolkit that I use, actually, which I must share. I use a lot of acronyms in my practice because I love hooks for people to remember. And my key one is lifestyle first. It's sort of, what I model all the time is we've got to think about our lifestyles before we do anything. So the L stands for life's purpose. So thinking about what matters to you. I is identity. Again, what we've talked about, the who am I piece. F is food. E is exercise. S is sleep. T, time out. Y is your connections. L is learning habits, and E is emotions. And first, of course, you need to be committed to your lifestyle. So these are sort of my 10 roots of health that take us all the way back, as you were saying right at the beginning, to the roots of our function, to the roots of our health. If we start to focus more on exercise, food, how we sleep, how we take time out, how we relax, what our emotions are telling us, we are going to be healthier and happier just by focusing on our lifestyle, for sure.
I love that, the lifestyle. I'm gonna print it out and put it right here in front of my office and say, and then put your name on there, Dr. Patel's reminder. That's great. I love that.
Thank you.
Fernanda, was there any other questions you had for the doc? I know we're running out of time.
The only other thing that I wanted to ask is if you can give 3 different ideas or 3 different things, maybe things that you have done or you recommend to your patients in your practice, things that we can all do when we're feeling that burnout. And you mentioned already doing things that feel good, doing things that are healthy. You mentioned exercise, but what are things that you go, like the first go-to things? Maybe the breath would be one. What else do you do immediately for you to feel better when you're feeling that burnout sensation or that feeling?
Yeah, no, definitely the breath, it's with you all the time. It's a definite go-to. What else can I tell you? Well, right now I'm standing up. And actually, we know that standing up is so good for us. Sitting is our trajectory to ill health and diabetes and cancers and heart disease and all sorts of things. So actually, just stand up. It really increases your agility, your mental agility, and your physical agility. And that, again, is very, very easy to do. And I guess the third thing we're talking about, sort of reward and dopamine and feeling good, is actually make a list of those things that make you feel good, so that when you need them on a rainy day, you've got those ready. Because when you're feeling not great, you can't even think of what to make you feel any better. Simple things like stroking your dog, or stepping out into the sunlight, or looking at the journal that you've been writing, anything that actually is going to give you that smile. And that's actually another simple tool, is to just smile, even if you don't feel like it, because the act of smiling itself is creating physiological changes as well.
That's awesome. That's awesome. Dr. Patel, if anybody wants to work with you, find out more about your services, where can people find you?
Yeah, sure. I've got a website, which is dralkapatel.com. So my name.com. I'm on all the social media channels as well as Dr. Alka Patel UK.
And your podcast, you have
Yes.
a podcast as well. Your podcast, the name of your podcast, you want to share that with us?
Yeah, of course. It's the Lifestyle First podcast, obviously, and there's a sister YouTube channel as well. So I've got the videos to go with that. That's Lifestyle First on YouTube as well.
That's great. We always want to learn. I think all of us, we're just driven to become better versions of ourselves. So what would be one quote that just really speaks to you, or you hang on to when something is just not going your way, or you're having challenges, or even when you're excited?
Yeah, it's a quote from Theodore Roosevelt that I look to, and he said, "Keep your eyes on the stars and your feet on the ground."
I love that one.
Yeah. And I love that because it keeps you moving forward, but reminds you where you are.
Mm-hmm. Beautiful. Dr. Linda, what's your quote for the day?
Oh gosh, there's so many, but one that just has been resonating with me is, to be the change that you want to see in the world. I think that's such a powerful quote, because whatever we see outside of us is a reflection of us, really. So if we see kindness in the world, then that's what we tend to work on. And if we see like, oh, the world is so this, and it's kind of reflecting of where our mood is at that time. So really just being what do we want to see in the world? That's who we need to be or act like.
Right.
And you?
My quote, and this came to me when we were talking about the titles and presenting ourselves as who we really are. It's a quote by Abraham Lincoln, and it says, "Whatever you are, be a good one." So no matter what you do in the world, just present yourself as your best self. And thank you so much, Dr. Patel. It was such an amazing time, such a beautiful, amazing episode. I learned so much. Dr. Linda taking notes. I'm taking notes. It was amazing. Thank you so much for providing us with this time and the opportunity to have this conversation with you.
Yes. Oh no, look, the gratitude is mine to you, actually, because I've absorbed your energy. You've been smiling throughout, and I'm loving your company. Thank you.
Thank you so much. We just love having you on. So, all right. Well, I guess we'll see you all. Well, I will be here next week, but definitely Fernanda will be here. It's my turn to be off for a week. So my phone's going to be turned off for 1 week, because I'm going to take the doc's advice about I'm going to nurture my soul, because I want to be a better version of me. So, but Fernanda will be here with an amazing guest. So I will be listening to it on the plane on the way back.
Mm-hmm. And as Dr. Linda meditates, I will bring you guys an amazing guest. It's been a mentor, a coach. Is someone that I consider a very important part of my life. You guys are going to get a ton of value as well. And coming up in the next month, we're going to have also Les Brown, today's his birthday. So he's turning 76 and still giving amazing value to all of his listeners. And we will keep you posted with that episode and all of the other episodes to come as well. Thank you so much for joining, and we will see you guys next time.
See ya. Bye.